Hello, I'm Catherine Luby from the Office on Child Abuse and Neglect in the Children's Bureau. With me today are Dr. Jeff Linkenbach, Director of the Montana Institute, and Dr. Bob Sagi, Senior Fellow at the Center for the Study of Social Policy. Thank you both for joining me. I appreciate it.
Thank you for inviting us.
Jeff and Bob have been partnering with the Children's Bureau and our grantees to incorporate the science of the positive process into child welfare and reinforce the healthy, positive, and protective factors that already exist in communities. For the next few minutes, we will offer some practical approaches to integrating the concepts of hope and concern into your work and dialogue about child welfare. Additional information is available online through the Friends National Resource Center at friendsnrc.org under Network for Action. Let's get started by talking about what we mean when we say integrating both hope and concern.
You bet. We're all experts with the concern side of the equation. We're very good at identifying risks and problems and concerning trend lines. But hope is what motivates people to change. It's what inspires them to engage and speak out. Essentially, hope is our call to action. And hope is what can transform the culture around child maltreatment. The science of the positive is a process that actually calls us to find ways to integrate both hope and concern with messages and different communications. To do this, we really need to train our brains to think differently, to see things that we haven't been seeing, and to hear some things that we've not been hearing by collecting data, new data in different ways, which can lead us to taking new actions and completely shifting the public conversation around child and family welfare.
Bob, how might this apply to those of us in the field of child prevention?
Child abuse prevention, what we do in child abuse prevention is we try to balance ACEs and hope. And ACEs, of course, is the Adverse Childhood Experience study that demonstrated the effect on early brain development of things like child maltreatment, child neglect, parental separation, domestic violence, all of those things on the developing brain. But we also know that positive experiences have a huge effect on the developing brain and subsequently on our health as adults. So the health outcomes of positive experiences like the attachment between an infant and his or her parents, the verbal back and forth between toddlers and their parents as they're learning to speak and and they're being read to at night, all of those linguistic things have also positive experiences that lead to lifelong health outcomes. For teenagers, community engagement seems to be one of the major ways you help teenagers through that difficult transitions in life. So the lesson for us as workers in this field is to use what the parents want, their hopes, to make those positive experiences and identify what's in the community, what after-school programs, what the faith-based communities offer, where are the playgrounds, where are there safe places for kids to play or learn to ride a bike or swim or whatever. How to help parents make those social connections, how to help them with the parental knowledge. And we look at that as well as the deficits, as well as treatment for mental health disorders, substance abuse, all of those things. Then we can make progress with our families and we can make that connection with them that's so important for our work much tighter.
That's excellent advice, I think, for child prevention maltreatment. How might this apply to leaders and managers today in their work?
There's a huge body of research that talks about how we are motivated more by positive environments and messages than negative environments or messages, which actually make us feel powerless to act. So what we can do as leaders is, and do this right now, is to be purposeful and very intentional about where we're focusing our energy, our conversations, our priorities. And we need to learn to see each situation through that lens. There's hope and there's concern here. And again, this takes practice. We have to train our brains. It's often not natural. We have to train ourselves into seeing in a new way. And it will absolutely impact how we see ourselves, the data that we're collecting or need to collect, and the people and the communities and the systems we serve. I think as leaders, integrating hope and concern in each situation is really essential for attracting collaborators or funders. It helps us to energize and keep our team energized. It sustains the efforts, which is always a concern with programs. How do we keep this going? And it mobilizes community and stakeholders. They absolutely want to gravitate around something that gives a sense of hope for reducing very important and serious problems.
Thanks.
Yeah. And we think about hope. One of the things we need to do is collect data about what's available in our communities and what the past experiences of people in our community have been. So we can do the kind of community scan I talked about just a moment ago. What resources are available to help families? In some states, leaders are also beginning to ask questions on their behavioral risk factor surveys, other statewide surveys, where they ask people about questions that touch on resilience, on positive experiences, on what supports them as parents and families. Because when we communicate with our clients, with ourselves, and with our communities, integrating hope and concern reflects the complexity of human life and allows us to really be part of the community, and not just a group that sits there and says we have this deficit, and the other, but to acknowledge that all of these things are integrated and all that complexity is in our work. And that's how we can become effective. That's how we can become effective at reducing child maltreatment, by weaving all that complexity together.
I really appreciate this discussion, really balancing and using both hope and concern within our work. I would be curious if you had any closing thoughts for our audience before we wrap up today.
Yeah, I guess I would say that we hear a term like science of the positive, and I think it's easy to think that we're just going to gravitate just towards only looking at the fluffy, positive side of life, and life is not that way. It's complex. There's paradoxes. There's struggles, and we need to present that context. I think balancing hope and concern and integrating these allows us to bring hope into some situations that can be very, very dire. So it's not about ignoring those things that are concerns. It's about being able to have the energy to really, truly address them.
Yeah. Jeff, I'm so glad you brought that up, because I think that this way of viewing things helps sustain all of us who work in this field. Because the looking at families through a more complex lens that weaves hope and concern sustains us. Because if it's always concern, then it's always draining. And there's a lot of vicarious trauma from that. But if you begin to see the beauty in the families and in our collaborators through the lens of hope, it allows us to sustain our work.
I appreciate that. On behalf of the Children's Bureau, I'd like to thank you both for your insight and expertise this morning. And I'd like to thank you for watching. We hope we've given you some ideas about ways to apply the science of the positive to your work in promoting healthy children and their families.